We are speaking about biological dentistry, and in a way to see your body as a whole, it is important to understand that periodontitis and this chronic severe inflammation on the gums is linked as well with other diseases. So periodontitis can trigger diabetes and vice versa. Usually when we measure between the gum and the root of the tooth, usually we have 3 millimeters. Okay. This is normal, this is anatomical, we expect to have that between 1 to 3 millimeters. If you have more than that, we already know that something's going on.
Welcome back to Dr. Rose Biohealth Podcast. Today I am joined by Dr. Nicolle. I enjoyed listening to your last one so much that I thought that we would delve a little bit deeper into the power of periodontics.
Absolutely.
So Dr. Nicolle is our general practitioner here in our DIFC clinic. She specializes in many, many things, such as biological dentistry, cosmetic dentistry, and periodontics as well. Most importantly, you are a mum dog of Lupo. There really isn't anything that you can't do. What I really enjoy about these podcasts is when I am asking these questions, I'm learning myself. So it's really good for our listeners to see it in a perspective where I'm asking real questions that I don't know the answers to. So I think it's really, really good. The powers of a periodontic. I don't know huge amounts about it, so I'm really excited for today's podcast. So I do have a couple of questions for you today, okay? So can I ask, what is an example of a periodontic disease?
Yeah, let's just start from the beginning. Do you think it's normal for your gums to bleed? What do you think? Is it normal when you floss to have some bleeding or no? What is your intuition?
Mine would say yes.
Yes?
Yeah.
So you think it's normal?
Bit. Yeah. So when I floss, my gums bleed slightly.
Okay. I'm sorry to say, this is the very beginning, of something that we call gingivitis, which is an inflammation. Do you think it's normal if you have a cut on your finger or if you have a cut in your arm? Yeah. Do you think it's normal to bleed? It's not normal, right? To have bleeding.
Not if there's a cut. No.
Yeah.
Okay.
So the same thing. When we have bleeding gums, it's our body telling us, listen, you have a small cut on your gums, and that's why every time you floss, you bleed. Okay. So this minor inflammation that we have in the gums is called gingivitis. Okay. It all starts from the beginning. Let's say you accumulate a little bit of plaque, you accumulate a little bit of bacteria, and then this bacteria can trigger some inflammation into the gums, and then it bleeds. It can get swollen, but basically when you brush, when you bite something hard, or when you floss, you can have this gingivitis.
Wow, okay.
Okay. It can progress in a second moment to something that we call periodontitis. Okay. You need to be susceptible to have that. But periodontitis is a more severe chronic inflammation. Okay. If you accumulate plaque, if you accumulate bacteria. So it starts with gingivitis, then you get swollen gums. This plaque can move, bacteria can move under your gums, and then it can progress to something more destructive. Mm-hmm. So it destructs basically the support of your teeth. Okay. The bone, the surrounding bone of the roots, the cementum, which is something that it's like a protection of the roots. Okay. And the fibers. So the cementum hold the fibers, and the fibers are touching the bone. Oh, wow. If you have an inflammation due to bacterial growth under your gums, you can destruct the support of your teeth. Oh, wow. And this is quite silent. Usually it happens when you are adult. Okay. The diagnostic is mostly around when you are 40 to 50 years old. Okay. Mostly, but of course it can happen before. But yeah, it's basically the destruction of the support of your teeth. And it can trigger too many consequences.
Is this hereditary? Or is this something that is fueled by food or
Perfect.
Lack of brushing?
Yeah. So it all starts with bacteria overgrowth, right? And then gingivitis, everybody can develop. So it's not something that is genetic, There are some medications that you, if you are taking or even pregnancy, that you can triggers a little bit more inflammation. But gingivitis, everybody can develop. Periodontitis, no, there is a genetic component, so you have to be susceptible to develop this disease. And in the population, we know that about 40% of adults, they have periodontitis. It's linked to many systemic disease, such as diabetes. So there is a two-way effect between diabetes and periodontitis. So periodontitis can trigger diabetes and vice versa. Food also. If you have a high consumption of carbohydrates, sugar, it can trigger inflammation to your body and contribute, of course, to the inflammation of your gums. But all in all, you have to be susceptible to have this severe chronic disease that is called periodontitis. And then usually it's silent. So people notice that sometimes you have a little bit of bad breath. It's not bad breath only when you wake up. Even now with the pandemic, right? We are wearing masks all the time. So people are noticing more this bad breath. And so this could be a factor from the periodontitis. Bleeding, a little bit of swollen gums. Usually it's something chronic, so it doesn't hurt too much. Even though sometimes you can have some painful episodes, let's say. But that's why it's so important for the dentist or the specialist periodontist to investigate and to do an examination, using an instrument that we call periodontal probe.
So would you recommend then, if someone is having issues with their gums, to go and see a specialist periodontist?
Any dentist is able and trained to identify periodontitis. Of course, the specialist is the dentist that is trained to
specifically
investigate this disease. So we are quite trained. I personally did a master degree on that and a specialization back in Brazil. So I studied quite a few years only this topic. So it for sure is something that sometimes I look and I already know, but all dentists, they are able to investigate and to at least diagnose properly, by using this instrument that is called periodontal probe. So we can measure basically usually when we measure between the gum and the root of the tooth, usually we have 3 millimeters. This is normal. This is anatomical. We expect to have that between 1 to 3 millimeters. If you have more than that, we already know that something is going on. So we classify basically periodontitis by many things, but one way to observe that is to have bleeding when we probe and more than 4 millimeters. So it's something specific, but it's a simple thing to do to diagnose, and also X-rays can contribute quite a lot for that.
Amazing. So I know we've spoken about how different foods and it can be hereditary as well. What about smoking? Smoking is very important. We know that smoking itself does not cause periodontitis, but we know that if we are treating a person that smokes, it can make the treatment very difficult because the person do not respond the same way as a non-smoker. So it can make the treatment a little bit more difficult, right? The response of the person is more difficult. And also the nicotine can constrict the blood vessels. So it's very tricky to diagnose sometimes the disease itself because not rarely the smokers, they don't bleed too much. So the disease is kind of masked because of this condition, because of the nicotine. And that's because the inflammation, the narrowing of did you say the blood vessels?
The blood vessels are constricted by the nicotine. So usually they don't bleed as much. So it's kind of masked, And so it's the severity of the disease is increased as well. If we compare people that smoke and people that don't smoke. If you smoke, the severity, the progression of the disease is much increased. So it contributes in a negative way for the periodontitis.
That's crazy. I just can't believe that. Did you say 40% of the population?
Yeah.
That's a lot of people.
Yeah. So between there is another very important number. So you have the idea of smoking and periodontitis. 90% of the people that do not respond for the treatment of periodontitis, 90% are smokers. Yeah. Also, I think it's very important to bring up here that we are speaking about biological dentistry, and and in a way to see your body as a whole, it is important to understand that periodontitis and this chronic severe inflammation on the gums is linked as well with other diseases such as diabetes, cardiovascular disease, Alzheimer, pulmonary disease, kidney, and so forth. So it is very important, the correct diagnostic, and as much earlier we investigate that, the better, of course, because the treatment would not be so challenging. Yeah. And after the treatment is very important as well for the patient to come in a stipulated time, let's say 3-4 months, right? For us to check if everything is okay. Mm-hmm. And the home care also has to be excellent. The patient has to understand that it's very important to clean in between the teeth, either with an interdental brush, which is a little brush that you can clean between the teeth, mm-hmm. or flossing, right? At least once per day. And now we know that it's better to floss before you brush your teeth.
Of course.
Then brushing your teeth correctly 2 to 3 times per day is also important. So the home care is something mandatory, let's say, for any patient that wants to prevent and even after treatment of periodontal disease.
If left untreated, what are the causes? Can someone lose a tooth?
Yes, absolutely. If left untreated, and this is the majority of the cases, what happens.
Wow.
Because people don't usually feel. Because it's a destructive disease, right? It's going to destruct little by little the surrounding bone and the surrounding structures that hold your tooth in place, and eventually the teeth can become wobbly, and then you're going to lose your teeth.
Wow.
Yes.
Mm-hmm. Okay, so it's absolutely super uber important that people come in even for their checkups.
Yeah.
Because a general practitioner will notice these periodontal diseases and will refer over to a specialist.
I think numbers, they explain very well for us,
absolutely.
Right? When we have numbers, we understand how severe this can be. And if we check the adult population, mm-hmm. let's say, if we check the adult population that loses the teeth, 70% is going to be caused by periodontal disease. So you understand, if you put all the adult population that loses the teeth, is a quite great number, is 70%. So mm-hmm. There is a huge impact overall in the future, right, for the patients.
Of course. And just ever so quickly now, how does someone decrease this from happening at home, their aftercare?
Yeah.
What is it that they can do to stop these periodontal diseases?
It's a sum of things that you can do. First of all, your lifestyle, mm-hmm. exercising, eating well is something very important. Having good habits of oral hygiene, right? So brushing your teeth 2 to 3 times per day, cleaning in between the teeth at least once per day. Visiting your dentist, your hygienist regularly is another way to prevent that. But I would consider a lifestyle, mm-hmm. because periodontitis is linked to many chronic diseases in both ways. Chronic diseases are also linked to periodontitis. So if you have a good lifestyle, you can prevent not only periodontitis, but you can prevent overall many other diseases. So it's a combination of managing stress, managing the food that you eat, and overall lifestyle.
And that's why we're a biological dentist.
Exactly.
Because we look at the patients as a whole.
Exactly.
That's why we offer that service in this clinic. So
Wonderful.
Thank you so much.
Thanks to you, Shani. I really enjoyed.
I know, Ami, and I learned so much. So thank you so much for that.
Thanks to you.
And
thank you.
We look forward to welcoming you back.
Yes, sure.
Thank you.
Absolutely.